Hello, everyone. Welcome to our HME Business Strategies and Solutions. My name is Lori Watanabe. I'm the editor of HME Business, and I'm happy to welcome John Burns and Sarah Lyons as our presenters from Dynarex. But before we get started with John and Sarah, let's just tackle a couple of housekeeping items. First, after our presentation, this webinar will be available to watch on demand on our HME Business website. We'll be taking questions right after this presentation, but you can submit questions at any time during the webinar. To submit your question, use the Q&A window on the right on your screen. You can also ask questions if you are viewing this on demand. You can submit real-time feedback for our presenters by using the reaction emojis, and you can use the resources widget to access the PowerPoint presentation and other resources. If you have technical difficulties during the webinar, we recommend refreshing your browser and also closing down any apps you're not using at the moment. You can click on the yellow question mark button at the bottom of your browser window if you do need additional help. Our webinar, as I mentioned, is sponsored today by Dynarex. And our thanks very much to Dynarex for that sponsorship and to Dynarex CEO Zalman Tenenbaum. So here is the agenda for today. As you see, after I introduce John and Sarah, they'll be going over the global home healthcare market, talk to you about some respiratory technology and some final takeaways, and then we'll have our interactive Q&A session after they finish their presentation. So now I'm happy to introduce our speakers, John Burns and Sarah Lyons. John Burns is Director of Corporate Training and Events at Dynarex. With a career spanning more than 2 decades, John has extensive experience in marketing, product development, and training within the healthcare industry. Throughout his tenure, John has demonstrated a remarkable ability to develop comprehensive marketing and training strategies that drive Dynarex brand awareness and market expansion. He's designed and implemented training programs that effectively educate internal teams and external partners on product knowledge, sales techniques, and industry regulations. John's dedication to training has contributed to a highly skilled workforce and enhanced customer satisfaction. Sarah Lyons is a registered respiratory therapist and respiratory director with more than 2 decades of experience in diverse medical settings, including trauma, ER, OR, NICU, and step-down units. As a student instructor for respiratory students, Sarah's expertise spans a wide range of respiratory therapeutic techniques, enabling her to optimize patient health and recovery times. In collaboration with Cleveland Clinic pulmonologists, Sarah co-authored a research paper during the COVID-19 pandemic that was published in the Journal of Intensive Care Medicine. Sarah is passionate about education, both for aspiring professionals and her own continuous learning. So welcome to John and Sarah. John, I'll turn the microphone over to you now.
Thank you, Lori. I appreciate that. Nice to be here today. The growing market in home healthcare is expansive. Since it's estimated that it will reach $383 billion in revenue by 2028, which is just in 4 years. The continued growth is going to be, it's been predicted exponentially between 2021 and 2031, this next 10 years. But the expansion is not just of the growing, aging population, but there's several factors that come into play. So let's dive right into that. There's a variety of trends and factors that are contributing to the home care market. The evolving healthcare preferences. The industry is evolving and it needs to meet the needs of the population. So let's dive into 2 very significant aspects of the growth. Excuse me. The home care industry is expected to have a 7% annual growth rate. So the home care industry is most definitely one of the fastest growing industries with annual growth rate of about 7%. In 2020, the market for home care was valued at 100.4 billion. That's pretty significant. By 2027, it's expected to reach 225.6 billion, with a compound annual growth rate of 11%. One of the things is the demographic trends. 70% of home care patients are aged at 65 or older. And some of the statistical facts and the importance for the senior home care services is that 70% of home care patients are aged at this level, 65 and older, and 1/3 of the individuals are receiving home care. And they are under the age of 60 as well, that need help with various home needs. So that's continuing to grow. Now, for the home medical devices market, the outlook in the next 10 years, what is the key medical device market dynamics? Well, there's a few. Let's start off with the increasing geriatric population. The geriatric population grows. Market players have to be forced to develop more and complex medical devices that are effective, that they're precise, they are user friendly, and then consequently the older people find an increase for more monitoring devices, more mobility aids, therapeutic devices, and that all leverages out the market growth. One of the next points is advancement in the medical device industry. There's been so much new technology. All the advancements with remote patient monitoring has become an excellent form of the growth strategy for medical device companies. Several players have integrated the internet with medical devices through technological advances, which facilitate patient provider communications. We all have heard of telemedicine and mHealth technologies. They've all adopted this and built-in conductivity of medical devices through more applications that are mobile, supported by cloud services and machine-to-machine connections. And one of the most important ones is the rise in healthcare costs. So as the healthcare costs continue to rise, the home care market, the equipment for the market is expected to expand as home care equipment saves patients the time and saves them money spending on clinical diagnostic procedures, and continues the monitoring, allowing the industry to flourish in many economically disadvantaged areas. So let's talk about opportunities. There's plenty of opportunities. Developing cost-effective home care medical devices for better patient assistance is just building and becoming more and more of an opportunity for the players in the market for the home care medical device industry. It helps grow the business significantly over their forecasts because of the innovative marketing strategies they can put together. They have to comply with the government initiatives related to reimbursement policies, which continue to change. And that's for the home care devices that will basically improve upon the demand for home care devices and help the key players in the market. So what's the total growth outlook for the North American home care medical device market? Well, North America is estimated to capture 33.2% of the overall home care medical device market. Now, this is owing to the increasing elderly population, in various states, but more importantly, the rise in respiratory diseases like COPD and chronic diseases such as asthma, diabetes, blood pressure issues, and other factors for the growth of the market. And we can't forget COVID as well. So with that, I'm going to turn it over the next slide to introduce one of our most competitive and comprehensive respiratory product lines in the industry. And that's hand this over to Sarah.
All right, we're just going to go over some of the Dynarex equipment that they have to offer. And the first thing that we're going to discuss is the Venturi masks. Venturi masks, some people refer to them as air entrainment masks or Veni masks, are used for COPD patients. They're the best oxygen delivery device for them. They work by mixing oxygen with inhaled air to deliver a known oxygen concentration to patients that need to have a controlled oxygen therapy. They can deliver 24 to 50% FiO2, and that makes them considered a high flow oxygen therapy device because they have an ability to provide a total inspiratory flow at a specified FiO2. The different colors of adapters give different amounts of oxygen. They come with crush resistant tubing that keeps the oxygen flowing even if it gets pinched. One of the biggest mistakes that people use when using Venturi masks is they throw the plastic adapter or the plastic cover away that goes over the colored adapters. And the purpose of that plastic cover is to ensure that nothing blocks those holes. With the 100% oxygen running through from a tank or a concentrator, it has to entrain air with it to dilute the oxygen. And if those holes get covered, then there's nothing to dilute the oxygen, and that can be very harmful or fatal to patients that are CO2 retainers. Dynarex also offers nasal cannulas. There are a couple different types of nasal cannulas. The first one is for any patient. It's the standard tip nasal oxygen cannula. These can be used for patients that are nose breathers. If they're a mouth breather, then a nasal cannula probably won't help them as much. Typically, nasal cannulas are ran at 1 to 6 liters per minute. If they are ran at more than 3 liters, it's recommended that you use humidification to control drying out of the nares and bleeding. Oxygen contains no moisture, and it can dry out the nasal passages very quickly. The prongs that go into the nares are curved, and they should be placed in the nose with the tips of the prongs curving down so it follows the actual anatomy. If they're upside down, the tips of those can hit the top of the nares and cause irritation and even blockage of the oxygen that's getting to the patients. They also have flared tip nasal oxygen cannulas. So if a patient has larger nares than normal, these are best to be used. And the reason for that is the flare tip acts like a gasket, and it takes up some of the room between the cannula and the nostrils, allowing better use than a standard tip. And also if you're using a pulse demand oxygen system, and it just helps keep the oxygen going into the body as opposed to it escaping out the nares. Then there is the cushion tip nasal cannula. It's much more comfortable for patients. It helps reduce irritation in the nares. It can limit or eliminate the kinking in tubing. And for patients that wear a cannula all the time, it increases their comfort, which will in turn help them be more compliant with the use of their ordered oxygen. The Dynarex nasal cannulas do not contain latex, so that should not be a factor for latex allergy patients. The super soft touch cushion tip is very much like the last one that we just saw. They come in pediatric and adult sizes, so you'll want to make sure that you get the right size of cannula for the right size of patient. Too small of a cannula on a larger patient will not get the oxygen in as far as it needs to, so you'll want to make sure to use the correct size. The shorter tips are for the kids, and the longer tips are for the adults. A lot of people who use oxygen for long term will often get skin breakdown or irritation around the cartilage of their ears, sometimes on their cheeks. So the cushion tip with the ultra soft ear foam helps prevent the skin from chafing or breaking down, and is really good to use for patients that are on it 24 hours a day. The oxygen supply tubing is used if a patient is at home and they are mobile. You can connect it to the nasal cannula and they can walk around. If they only have the nasal cannula, they're kind of stuck to a certain spot. Usually those are only 4 or 5 feet long. The longer the tubing for the oxygen gets, though, you have to ensure that the patient is getting the right amount of oxygen. So if a patient is on low flow oxygen, say 2 liters, and you add 2 extension tubings, then it's going to take a lot longer for that oxygen to get to the patient, and it could be diluted. So you'll want to make sure they get the correct amount of oxygen. And then there are multiple oxygen therapy accessories. The nasal oxygen cannula deluxe earphone covers are to soft wraps that fit on a nasal cannula headset, which again protects the skin from chafing and discomfort. And all of these are also latex free. They can be used for adults and pediatric patients. The oxygen tubing inline water trap, it collects excess moisture from the tubing. When you add additional humidity, it will keep the liquid away from the patient's nasal passages. And these should be placed between the nasal cannula and the extension tubing itself. And the moisture that collects inside the tubing is referred to as rainout a lot of times, and you don't want that to be inhaled through the nose of the patients. There is also a 22 millimeter tapered nipple adapter and oxygen tubing adapters, and those are used to increase the connectivity and reach more of the tubing during the respiratory treatments. It's important to know, again, that the longer the tubing is, it gives them more freedom, but can also reduce the flow that they are receiving. A good way to check that is to check their pulse ox if you're adding longer tubing for them. One of the best things that they have made, in my personal opinion, is the oxygen tubing swivel male-to-male adapter. It allows the tubing to rotate in a 360-degree rotation, and that keeps the tubing from tangling or kinking, and it gives the patient added mobility with less hassle. And then if you follow along on the pictures on the screen, you can see that there's a nut nipple adapter, and that's a stationary adapter for oxygen connection. It's best used for patients that are immobile or have limited mobility. The portable oxygen liter meter is a small compact concentrator flow check, and it can be used to quickly verify the flow of gas by attaching it to the oxygen supply line. So this would be good to use when using extension tubing. You can make sure that they are getting the correct amount of oxygen. And to use it, you attach it to the oxygen supply line and hold it in an upright vertical position. And you'll see that there is a floating ball inside. And where the middle of the ball is, it'll tell you the flow of the gas. And it's typically used for flows up to 10 liters per minute. And we're going to move on to oxygen concentrators. Oxygen concentrators are largely used for home use. You can use these with or without humidity, and they offer ranges up to 5 liters per minute. The concentrator itself has an outlet pressure of 6 to 10 psi, and that's the max. And they're very easy to use and designed for quiet operation. They also have adjustable audible and visual alarms. And the oxygen concentrator also comes with accessories. The first accessory is sterile water for inhalation, and these are disposable pre-filled bottles used to provide extra humidity to patients that use oxygen. The water is sterile for patient safety, and they help avoid cross-contamination. They cannot be used for high flow oxygen due to the increased pressure in the bottle, and they attach to the nut nipple adapter and have an outlet for the oxygen tubing to connect to. They sell them in two sizes, the 350 ml and the 550 ml bottles. The dry bubble humidifier is not disposable, so you'll want to make sure that it gets cleaned routinely. It's a 400 ml bottle. You use distilled water in it, and distilled water is the safest option because it will extend the life of the humidifier. That water can be purchased at the grocery store or pretty much anywhere, so it's pretty convenient for the patients. There is an elbow connector that can be used to attach the bubble humidifier bottle, and it will attach that to a continuous flow oxygen concentrator. Or you can use the straight connector humidifier tubing, which is universal. It's very sturdy tubing that attaches a dry humidifier or one of the pre-filled bubble humidifiers to the oxygen concentrator itself. Oxygen regulators. Oxygen regulators are used for any type of E-tank, H-tank, any tank that you would have in the home that's not a concentrator. They are made to safely administer oxygen at home, and you can easily adjust the flow rates. It has easy to read dials. The gauge on the front of it goes from red to green. And the closer you get to red, then that's where your tank is going to be empty. So patients can keep an eye on how much oxygen that they have. And if there are different sizes and different sizes of outlets for each tank. And to see those, you can go to the Dynarex website and find out which one is compatible with your type of oxygen tank. This chart right here is the different types of regulators, and it shows you their flow range. And this is the chart that is on the Dynarex website. One of the newest accessories that Dynarex has is the portable 50 PSI compressor. It's a new addition to the Dynarex line, which is very nice for patients that are at home that have an artificial airway and many other reasons. It allows for higher flows of oxygen that are often used in the hospital setting. They are great to use with heated nebulizers, humidifiers, nebulizers, and mist tents. It's portable, lightweight, and has easy to use accessories that can also go with it. Which brings us to the 50 PSI accessories. The corrugated tubing is designed to be used with the compressor. The high quality tubing is flexible and lightweight. The light color is easy to see through, and you can visualize condensation buildup or rain out, as we call it, because you can see through it. Anytime you add humidity to oxygen, you will get some type of rain out, and you don't want that to get to the patient at all. So you'll want to make sure to empty that if condensation does build up inside that corrugated tubing. It's disposable. It can be used for IPPB administration, also for trach collar setups, and it's very nice to have. And then the large volume nebulizer is also used with the corrugated tubing. And the large volume nebulizer is used to administer humidified gas. It can give concentrations from 28% to 98% FiO2. The bottle's durable and break resistant. It has a Venturi-style air entrainment ring with a dial for setting the correct oxygen concentrations. The transparent bottle allows easy visualization of the contents inside, so you know when to refill it. Dynarex also has home care suction canister kits. This is used to collect and contain aspirated secretions from the patient's airway and mouth. The canister itself is designed with a shutoff valve to help prevent overflow and leakage. They are adaptable enough to be able to be used with almost all portable suction units. And the kit comes with a canister that holds 800 cc's, 6-foot suction tubing, an elbow connector, also a suction bacteria filter, and 16-inch silicone tubing that is easy to cut. And it all connects to the suction machines that the patient would have at home. Aerosol masks are used for a lot of different reasons. They are designed for oxygen and aerosol administration and nebulized medications. All the masks have smooth edges, an adjustable nose piece, and an elastic strap, all to make the mask fit softly and appropriately to the patient's face. They are compatible with mist handheld nebulizers and can connect to the 22 millimeter corrugated tubing that we saw on the previous slides. They come in adult and pediatric sizes. And then there's also a face tent. Face tents are used for patients for a couple different reasons. Either they could be claustrophobic, or they're unable to tolerate a mask on their face. It could also be used for patients that have burns or wounds on their face, so no pressure is put on there. And the air and oxygen is forced in an upward direction towards the patient so they can inhale via their nose or their mouth. The small volume nebulizers come in 6 cc cups. They deliver aerosolized medications by transforming the liquid medication into an inhaled mist. These come with an anti-spill design, and that means that you don't have to keep the nebulizer cup sitting up straight. It will run even at a 90-degree angle. They can be used with a handheld or tabletop nebulizer. On the screen here, there is a picture of spring-loaded tees, and those tees would connect to the corrugated tubing, also using a 22 millimeter adapter. And you can put the medication cup inside the bottom where the cap is, and when you push the container up, it pushes a spring up. And then when the oxygens run through, it allows the medication, the mist, to go to the patient without taking the mask on and off or switching the mask. It's just an accessory to add in line with it. And then for pediatrics, there's a pacifier elbow. And for babies, this is fantastic to use to help them get the medication. The old school way was to give it by blow-by, but this actually acts just like a pacifier, and the medications would come out of the tip of the pacifier. Small volume nebulizers are available in 12 configurations, which means that they can be set up 12 different ways, and there's different sizes. And for you to be able to look at all these are also located on the Dynarex website. Compressor nebulizers. Dynarex compressor nebulizer is available for both adult and pediatric use. They are used to deliver aerosol medications in the home setting, and they come in 3 styles: the Elite, the Compact, and the International Compact. All can be used with a small volume nebulizer cup with a mouthpiece or face mask. And then the last slide here, the pediatric compressor nebulizers are fantastic for helping children overcome the fear of taking medications. They come in 5 cute little different animals, and they are used just like the other compressor nebulizers at home. And you can use a mask or a mouthpiece with these. They can be used with the interfaces of Dynarex, and they go up to 6 or to the 5 liters if you use. I'm sorry, I think I'm losing my screen there.
Okay.
I apologize for that. But yes, those are for pediatric, and so they're just a little more fun for the kids.
Okay, great. Thank you, Sarah. I want to just add a little bit about Dynarex and what they offer in terms of home care durable medical equipment. We have a complete line of home care medical equipment ranging from home care beds, a series of mattresses, a variety of mobility products from wheelchairs, canes, crutches, walkers, rollators, knee walkers, and a complete line of bathroom safety products, accessories, and a lot more. So you'd want to definitely check out our website, Dynarex.com. So some final takeaways. Dynarex offers ongoing marketing support. We have a robust Dynarex.com website, which has a lot of product information that you could take advantage of. Please inquire about our sales and product training through Dynarex University. We have many digital catalogs and sell sheets on the website. We are constantly in the news, so please watch us, follow all of our press announcements. Check out our bi-monthly Dynarex blogs. They're very interesting and certainly can help support your businesses. And then also like us and follow us on social media. We're on all of the social media channels. So in summary, Dynarex offers a complete respiratory product solution for the home care market. We provide consistent, great quality and value. We have national distribution and inventory all over the country, and we have a complete line of home care medical durable equipment for this market. So before we get to the final questions and answer period, I want to thank everyone on behalf of Dynarex. Dynarex, I want to remind everyone that Dynarex sells exclusively through distribution and can assist partnering you with the right distributor in your area. So you can contact us today or after the seminar for more information. You can go to our website, Dynarex.com, or you can go to the 2 emails on the bottom of the screen for more information. With that, I'll hand it over to Lori.
Thank you, John and Sarah. So we will get started on our Q&A portion of this webinar. Once again, if you'd like to submit a question, please use the Q&A window on the right on your screen. You can also ask questions if you are viewing this on demand, because we will be passing your questions over to the Dynarex team. Okay, let's start with an easy one as far as the questions, or I think it's easy. You mentioned about your training and sales educational opportunities. It's a 2-part question. First of all, professionally, what audiences are your sales and training sessions geared toward? Like, for instance, respiratory therapists, clinicians, or is it more on the dealer supplier side? And also, do you have any consumer resources?
Well, we offer two types of trainings. We offer for our distributor partners, sales training, skill training, and we also give them clinical training, but we have clinical training for our end users through our specialists. We have a specialist on staff with Respiratory Sarah that we can do a variety of different trainings. All you have to do is go to our website and sign up under the Dynarex University icon. And from a consumer standpoint, we don't sell to consumers. We only sell to distributors. But you can find a lot of resource information about the Dynarex product on our website.
Yeah, I've seen some really great blog posts, actually, I believe, on your Dynarex website that are quite consumer and caregiver oriented. So I definitely enjoy reading them. And based on that, the next question, when you're developing product, does your team consider also not just the patient, but the caregiver's role, such as if a system will need to be cleaned or maintained regularly? Do you also take into consideration what the caregiver will have to do and try to design with the caregiver in mind?
Okay, I'll take that. We have a very comprehensive new product development group that looks at our products, what products that we need, what products that we get suggestions from our distributors, from our end users, through a variety of different sources. And we are constantly looking at ways to improve the care for our end users through the products that we develop. And we're constantly coming out with new products. So if you've just tuned in to Dynarex, please keep an eye on us, because we're constantly introducing new products to help the end users.
Okay, thank you. Next question. Sarah, when Sarah was going through the different products and the different technology, she mentioned that there was quite a few of the products were available, for instance, in pediatric sizes or a range of sizes. So do you anticipate greater need for respiratory equipment going forward among patients who are not in the senior age category? So basically, do you anticipate as we go forward, maybe with COVID after effects, with asthma, et cetera, that the respiratory field will be working with more people, more patients who are not in the senior category?
So I can tell you, just still working in the field, most of the patients coming in are younger than 50. With the increase of family members smoking while they're pregnant, lack of neonatal care, prenatal care, they're in the field right now. There are a lot of children and young adults. It's I would categorize it as 50-50.
Wow, so Sarah, that's really interesting, because in the past it's been kind of an older, like we see seniors walking around with portable oxygen, but I can tell by all of the pediatric, for instance, products that you had, that you really have to think about it. Respiratory therapists and also engineers who are designing these products really have to think about kind of the whole age range going forward. Is that fair to say?
That is very fair to say. Every patient, different ages, can require different treatments, different size of masks, different needs. And we also see right now, I'm seeing a lot of younger and younger kids with artificial airways due to asthma, sleep apnea. A lot of children, sadly are overweight, and they are getting diagnosed with these diseases a lot earlier than they were, say, 20 years ago. So the amount of equipment needed for children and smaller adults is increasingly every year getting larger.
And I'd like to add to Sarah's comments. When we develop a new product and we come out with it, we come out with a variety of sizes, ranges, adult, pediatric, neonatal. So we cover the whole gamut.
Okay, well, a follow-up question then, and this is just for me, I'll be very transparent. If you're talking about children, if you're talking about younger adults who are maybe still working, you're talking about kids who are going to school, it sounds like as you're as you're considering their environment, that you might be talking about people who are very active, right? Not necessarily anymore in an assisted living center or just living at home, but maybe do you have to take into consideration that your systems, your equipment, your accessories need to be portable? They need to be able to stand up to, being in different places, going out to restaurants, to church, to school, to visit grandma and grandpa, etc. Is that kind of how your thinking also has to be if we're dealing with younger aged patients?
Absolutely. Yeah, we're constantly looking at all the versatilities of what one is using based on what environment they're in, from young to old, because there's a lot of different demands for older and demands for younger folks.
Okay, next question is about your Resp-O2. Was that developed from feedback or based on feedback from the folks on the front lines of the respiratory industry? And I guess that my broader question would be, how do you develop new products? How do you decide when you need to come out with a new product or product line, or maybe when you need to expand the accessories, the ranges, et cetera? Is that all basically based on patient and respiratory therapist feedback?
We get feedback from a variety of different sources. We get feedback from respiratory therapists. We get feedback from our sales group, who talk with distributors and end users all the time. We go to trade shows, national trade shows. We go to conferences. We pick up a lot of information across the board. Matter of fact, the president of our company, Zalman Tenenbaum, visits customers and end users, gets feedback, and we collectively look at how we can constantly expand the line and really meet the needs of our customers.
Okay, thank you. Next question. What is the most important thing to watch for when placing a non-rebreather on a patient?
So one of the masks that we didn't discuss was a non-rebreather. And a non-rebreather is meant to give 100% oxygen, but you can't always get quite that high. So a lot of times you'll see people who are in acute distress and they need to have the oxygen, the non-rebreather, placed on them. But if that bag that's on the end of it is not inflated, then the patient is not getting the oxygen. That bag is intended to be a reservoir of oxygen for them to inhale. If the bag is flat, then they're inhaling their own breath, which is rebreathing their CO2 levels. And the other thing is, you have to be really careful with patients, that have COPD, that you do not give them that much oxygen, but you could essentially suffocate a patient with a non-rebreather if the bag's flat. So following the recommended use of the products is a huge part of anybody using any type of equipment.
Okay, thanks, Sarah. Next question. Why are Venturi masks the preferred oxygen delivery mask to use with COPD patients?
And that kind of goes hand in hand with the non-rebreather question. And you can get a set amount of oxygen with those. So if you give certain patients too much oxygen, it can wipe out their drive to breathe. So with COPD patients, you want to give them a lot of flow, but not as much oxygen. And the Venturi mask that Dynarex offers has all the different adapters for that.
Okay, great. Thank you. Next, what are the most popular respiratory products in today's marketplace?
Okay, so there's a lot of popular products. Needless to say, our oxygen concentrators, our nebulizer compressors, our newest 50 psi compressor. all for home care use. Due to these increased illnesses and respiratory, both young and old. So there's so many. So, but those are just some most recent products.
Okay, and the final question I see on our list of questions that have come in, why does the Dynarex product offering include so many choices?
Okay. Well, that's a good one. Well, first off, respiratory therapists are very dedicated to the types of products and styles of products that they use. And one of the things that Dynarex has done when they've introduced all of their new products in the Resp-O2 line is to expand and provide lots of choices for the respiratory therapist. And this way they can choose from different types that they're used to. And we're basically, Dynarex becomes a one-stop shop for our respiratory product offering.
Okay, great. Thanks so much, John. We are just about out of time today, but before we sign off, I wanted to remind everybody that this webinar will be available for watching on demand. So within the next day or so, be on the lookout for an email from us that will direct you to the webinar archive. You can watch the archive again or pass it along to a colleague. Our thanks to John Burns and Sarah Lyons for being our presenters today, and thank you very much to Dynarex for sponsoring today's presentation. For HME Business, thank you very much for being with us today. We all wish you a great afternoon.
Thank you.